I'm Dr. Sri. I'm a board certified family medicine sports medicine doctor, and I also have a background in exercise physiology and integrative medicine. In this video, I'm going to show you how to eat in order to decrease chronic inflammation in your body, thereby helping to decrease your arthritis pain. So without further ado, let's get started. So me personally, I generally follow an anti-inflammatory diet, and since I'm from Asia, I follow a lot of Asian cuisine. So in this video, I'm not going to discuss on how specific foods reduce inflammation, and I've attached a blog article in the description box below where I've discussed those things in detail, and I've also attached the scientific references in the blog article. Now let's first talk about the first component of the anti-inflammatory diet, which are the vegetables. So vegetables should make up the most important part of your diet. So when it comes to inflammation, so think about things that can cause inflammation. So think about like damage from free radicals, or poor gut bacteria that causes inflammation, or lack of vitamins and minerals that usually act as anti-inflammatories. So vegetables can help combat these things with their antioxidant capacity or by feeding the gut bacteria in order to promote good bacteria and thereby lowering inflammation. And they also provide vitamins and minerals that act as anti-inflammatory. It is important to eat a variety of vegetables, not just one type, because different vegetables have different benefits. For example, broccoli and Brussels sprouts have a lot of sulforaphane, which can help fight cancer and infection, while tomatoes have lycopene, that is an antioxidant, whereas sweet potatoes have a lot of vitamin C that can help with inflammation. So let me explain how I incorporate vegetables in my diet. So usually I don't eat vegetables during breakfast, but for lunch or dinner, I either have a salad or a soup. So since I work, it's very easy to carry a salad rather than to carry a soup. So for example, yesterday I had an Asian tofu salad where I cut some bok choy, where I cut some like Chinese cabbage, scallions, and I made some peanut dressing, and I added some tofu for protein, and it was a really good salad. For dinner, I had a minestrone soup with celery, carrots, vegetable broth, and a lot of like Italian spices for seasoning. So one thing that I noticed from people is that people think that they can cut any vegetables they want, you just mix it together, add a salad dressing, and that's it. Unfortunately, it's very hard to be persistent in the long run because it's going to start getting boring, and then eating a salad starts to become more like a chore or a punishment. Instead of that, I would invest in a good salad cookbook. Thereby you start to discover new flavors. For example, you can have an Asian salad and then you can have an Indian salad the next day, and you can have an Italian salad the following day. So this way you start to discover new flavors, and thereby you start to look forward to eat more salads rather than becoming more like a chore or a punishment. Now let's focus on fruits, and I'll tell how I incorporate them in my diet. So fruits are so good for inflammation because they have a lot of fiber and have anti-inflammatory properties. Even though fruits have fructose, which is a type of sugar, they also have other good things that help your body to use insulin better, and thereby keeping your blood sugar under control. So what this means is that they don't cause a big spike in your blood sugar, provided that you eat healthy most of the time. Some people worry about certain fruits that can make your blood sugar go up quickly, like watermelon or mango, which is completely true. But as you eat more fruits and vegetables in your diet, your body will get better at disposing blood sugar quickly. So what I mean by that is that, for example, let us say you're suffering from insulin resistance and you're obese or overweight. And now you start to incorporate a lot of anti-inflammatory diet. And then what happens is that as you start to incorporate more healthy diet, your insulin resistance starts to get better, and thereby, let's say if you have a spike in your blood sugar from eating fruit, that will get better as you continue to follow the anti-inflammatory diet. So it's a good idea to eat a lot of berries like raspberries, strawberries, blueberries, and blackberries because they have abundant polyphenols and antioxidants that can help with inflammation. It's also good to choose fruits that are in season, or if you're not able to get fresh fruits all year round, you can always try buying frozen ones. So when the fruits are frozen, they stay good for longer so that you can enjoy them throughout the year. So usually in the morning, I'll try to add like berries and bananas to my steel cut oats, and that's where I get my fruits in my diet. Sometimes if I don't have time to make steel cut oats, I'll make a smoothie made up of like berries, bananas, mangoes, and things like that. And I'll try to make it pretty healthy by adding more greens to the smoothie and flax seeds and chia seeds and things like that. So the next thing that we're going to focus is the consumption of whole grains in your diet. So the key here is to focus on whole grains rather than processed ones. So for example, when you think of rice, the outer bran and germ contain a lot of nutrients. But let us say during processing, when these parts are removed, the grain loses important vitamins and minerals. It's also important to understand that the whole processed grains contains a lot of fiber, and then fiber is the food for our gut bacteria, and thereby once we flourish our good bacteria, that can also help reduce inflammation. It is better to choose whole grains like quinoa, bulgur wheat, steel-cut oats, or whole grain bread. So when you shop for bread, make sure that you can see visible grains in it. Aim for 3 to 5 servings of whole grains per day, such as maybe 2 servings in the afternoon, 1 to 2 servings of grains in the morning, and 1 serving of grains during dinner. So let me explain how I incorporate whole grains in my diet. So usually for morning, I'll have steel-cut oats with berries and soy milk and chia seeds and flax seeds. So usually I do it as an overnight soaked oats. Sometimes when I don't have time, I'll do a smoothie, or I'll do like a whole grain bread with peanut butter and banana. So for lunch, I usually have some sort of grains. Usually it's legumes is what I have, but sometimes I'll have like a quinoa or bulgur wheat also. For dinner, usually I'll have like a quinoa or bulgur wheat combined with some sort of like an Indian curry. It could be either like a lentil curry or a chickpea curry, and that's how I get grains in my diet. So next we're going to focus on legumes and beans. So the legumes and beans, they're high in carbohydrate, but they're also high in protein. So luckily, me coming from India, we always have legumes as part of our diet, and we cook like very delicious curries out of lentils. So for example, we make yellow dal, which is a curry made with yellow lentils, and we eat it with rice. We also make curries using garbanzo beans and red kidney beans, as well as black lentils. There are many options for incorporating legumes in your diet. I highly encourage you to explore an Indian cookbook to find more recipes that includes legumes. So legumes are a great source of both soluble and insoluble fiber, which help with digestion, and they also feed the gut bacteria, and they're about promoting good bacteria that can help lower inflammation. They're also rich in protein, even though some legumes may be low in certain amino acids. However, when you eat a variety of grains in your diet, this is not a concern at all. I recommend adding at least 1 to 2 cups of lentils to your daily meals. So the next thing that we're going to focus on is fats. Unfortunately, fats have got a negative news coverage because of the link to heart disease and inflammation. The biggest problem here is that we have generalized all fats as bad. However, studies have shown that saturated fats, predominantly from animal-based sources, and trans fats, which are basically comes from processing a particular fat, is what is bad. Even though saturated fats from animal-based sources can be part of a normal healthy diet in limited amounts, we know clearly that consuming in excess amounts can be bad for our body. So even though these things are debatable, there is a general consensus that animal-based fats can have negative effects on the human body when consumed in excessive amounts. So what type of fats should be included in our diet? The first thing is nuts, especially walnuts, almonds, pecans, and Brazil nuts. These should be incorporated into our diet. Studies have actually shown that over-consuming nuts does not lead to weight gain in spite of being calorie dense. So people who have a predominantly nut-based diet tend to not have weight-related issues as per studies. It is important to eat raw nuts, but if you prefer roasted nuts, lightly roasting them should be fine. So another healthy fat option is olive oil. So extra virgin olive oil is the best choice. It can be used as a salad dressing, or you can use it to slightly fry certain foods. So it's important not to use excessive amounts of oil and avoid overheating the oil. So chia seeds and flax seeds are also excellent source of omega-3 fatty acids that have been shown to have anti-inflammatory properties. Including these seeds in your diet can help improve inflammation levels in the body. So let me discuss how I incorporate healthy fats in my diet. So usually I like to have chia seeds or flax seeds, or sometimes both, with my steel-cut oats, or sometimes I add it to my smoothies. So for my snacks, I like to have mixed nuts like pecans, almonds, peanuts, and sometimes my problem is that I overdo it, although I've not had any negative side effects like weight gain or so forth. Next, I like to use olive oil for my salad dressing, as well as olive oil for like a little bit of like a light frying. For example, I do tempering for my curries and things like that. I usually use olive oil. And I like to add avocados to my salad. So next thing we're going to talk about is incorporating fish in our diets. So including oily fish in our diets are important as they're rich in omega-3 fatty acids. It is common for people to consume more omega-6 fatty acids and not get enough omega-3 fatty acids. To ensure balanced intake, focus on consuming fish that contains omega-3 fatty acids such as mackerel, sardines, and wild Alaskan salmon. However, it's important to be aware of the potential mercury content and the environmental contaminants in fish. If you have concerns about these contaminants, you can still obtain the benefits of omega-3 fatty acids by incorporating the chia seeds and the flax seeds into your diet. Although chia seeds and flax seeds do not directly contain the EPA and the DHA, which is basically the omega-3 fatty acid component that has anti-inflammatory benefits, still the chia seeds and flax seeds, they contain ALA, which can be converted to EPA and DHA in our body. However, the biggest concern is that the ALA that is found in the chia seeds and flax seeds, all the ALA does not get converted to EPA and DHA. So only around like 10 to 15% of ALA can get converted to EPA and DHA, which is the active component of the omega-3 fatty acid that has the anti-inflammatory component. However, still there are risks and benefits of both. For example, with fish, if there's like too much of plastic contaminants, if there's too much of mercury contaminant, that can pose a threat to a person's health. So when you compare to that, flax seeds and chia seeds can be healthier. So if you're incorporating a good amount of chia seeds and flax seeds in your diet, then there's no reason that you have to worry about consuming fish for the anti-inflammatory benefits. So let me discuss how I incorporate fish in my diet. So usually I have fish like 1 to 2 servings per week. Sometimes I'll have like salmon and I'll bake the salmon with the spices that I enjoy. Sometimes it might be Asian infused flavored salmon, or sometimes it might be more like an Italian flavor infused salmon. Sometimes I'll get the tinned mackerel and sardines, and I usually like take the flesh out of it and I'll make a stir fry with some garlic, with some generous cilantro, with some chilies and things like that. Now let's talk about soy foods. So me coming from Asia, we tend to eat a lot of soy-based products in our diet. Initially, there was some concern that soy-based products can cause the increased risk of estrogen-sensitive cancers and so forth. However, there are multiple research papers that have debunked this theory. So with that said, I would highly recommend to include soy-based foods in your diet. There are some people who can be intolerant to soy. In that cases, it is best to avoid soy-based foods. So focus on consuming whole soy foods such as edamame, which is my primary choice. Another great option is fermented soy like tempeh. So tofu and soy milk are also good options. However, since they are processed soy products, I usually place them slightly lower on my list of preferred soy-based foods. So me personally, I like to eat tofu 1 to 2 times per week. Sometimes I like to make Thai style baked tofu, or sometimes it might be Indian style baked tofu. Sometimes I make even a spinach curry with tofu. So in terms of tempeh, I like to either bake the tempeh, or it can be again like a tempeh based curry, or you can also make like a tempeh stir fry. In terms of soy milk, that's kind of the milk that I use for my steel cut oats. What I'm trying to improve is to increase the consumption of edamame instead of like the tofu. Now we're going to talk about mushrooms. So Asian mushrooms, particularly shiitake mushrooms, they're incredibly beneficial for health. So shiitake mushrooms are readily available in most Asian markets and Whole Foods. Consuming them can have positive effects on our immune system and cognitive health. However, it's important to ensure that you cook the mushrooms thoroughly, as heat can destroy any small toxins present in them. So personally, I buy either the shiitake mushrooms or the enoki mushrooms. Sometimes occasionally I'll buy the white mushrooms or the portobello mushrooms. So usually with shiitake mushrooms and enoki mushrooms, I like to make like a Thai-based a soup, or it could be a Korean-based soup where I add a lot of like bok choy, Chinese cabbage and things like that, in addition to the shiitake mushrooms and the enoki mushrooms. And that's how I enjoy mushrooms in my diet. So while eggs are generally considered safe to eat, it is still best to consume them in moderation. So based on recent evidence, it is clear that eggs can be a part of a healthy diet. For most people, starting with 2 to 3 eggs per week is a good way to begin. If there are no negative impacts on your blood work, consuming eggs daily may be an option. However, it's always a good idea to keep animal-based foods low in your diet. However, I cannot recommend eating large amounts of eggs like 3 to 4 per day, and this is something that you have to discuss with your doctor first. So remember, eating eggs can help with muscle protein synthesis and weight loss, which in turn can reduce inflammation. So whenever possible, choose organic eggs, as they tend to have a more favorable ratio of omega-3 to omega-6 fatty acids. So me personally, I typically have around like 2 to 3 eggs per week. So usually I have either like a boiled eggs or like an omelette. So there used to be a time where I used to consume around like 1 to 2 eggs per day without having any negative side effects from consuming more eggs in my blood work. But still, I made a conscious decision to cut back on egg intake and focus more on plant-based foods as much as possible. So now, next we're going to discuss about dairy products such as like milk and yogurt. So similar to eggs, dairy can be a controversial topic too. However, when consumed in moderation, milk and yogurt can be part of an anti-inflammatory diet. So fermented dairy like yogurt in particular is rich in probiotics that can promote gut health and can potentially help reduce inflammation. It is important to note that many store-bought dairy products are high in added sugars, which can feed harmful bacteria and negatively affect the gut microbiome. So therefore, I recommend enjoying dairy in moderation, such as like 1 to 2 servings per week. So me personally, I don't consume dairy products too often. Sometimes I'll add cheese to my omelette, or sometimes I'll have pizza here and there. Sometimes I like to have milk, maybe like once every 2 weeks or so. Sometimes I'll make yogurt dressing for my salad, and sometimes I like to have yogurt rice. Now let us discuss about lean meats as well as red meat. So lean meats like chicken can be included in your diet, but it's important to consume them in moderation, perhaps maybe 1 to 2 times a week. While animal-based foods are high in protein, they can potentially have pro-inflammatory effects, although this is currently a topic of debate. As a general recommendation, I suggest opting for lean meats and consuming them maybe 1 to 2 times per week, while limiting red meat to once a month. So it's worth noting that the method of cooking meat can also impact inflammation. If you prefer to enjoy meat occasionally, it's best to avoid dry cooking or barbecuing or charring the meat. Now let us talk about spices. So incorporating healthy herbs and spices into your diet is highly recommended. Numerous studies have examined the beneficial effects of various herbs. For instance, turmeric has been studied for its antimicrobial and anti-inflammatory properties, while rosemary has been shown potential benefits for improved cognition. So you can easily include a variety of these spices in your meals, such as thyme, rosemary, parsley, cumin, turmeric, and chili peppers. Consider incorporating these ingredients into your cooking, including flavorful curries, to enjoy their potential health benefits. So coming from an Asian background, I incorporate a lot of spices in my diet. For example, I've already talked about how I make a lot of curries in my diet. So when we make curries, we usually add like garlic, ginger. We add a lot of like turmeric, pepper, cumin, coriander, and things like that to make our curries pretty tasty and flavorful. So sometimes I'll add like basil leaves and rosemary leaves to my salad dressing. Sometimes I'll marinate my fish with a lot of like Italian herbs. So this is how I include a lot of herbs in my diet. So next we're going to talk about green tea that has a lot of like anti-inflammatory and anti-cancer properties. I recommend to consume at least 1 to 2 cups of green tea per day. So when you purchase green tea, make sure that you opt for organic green tea, thereby helping to minimize exposure to pesticides. Enjoying a daily cup or 2 of green tea can contribute to a healthy lifestyle and provide numerous health benefits. So me personally, I've been trying to have green tea usually in the morning. Sometimes I completely forget about it, but usually when I do have green tea in the morning, it's definitely a refreshing day for me. So when it comes to alcohol consumption, if you don't drink alcohol like myself, it is better to abstain completely from alcohol. But let us say, if you do drink alcohol, it's probably better to switch to red wine that has more polyphenols that provides like the anti-inflammatory and antioxidant benefits. But again, moderation is the key. Make sure that you stick with like 1 to 2 servings per day and not more than that. So make sure that you follow the anti-inflammatory diet and you'll find your chronic inflammation getting better and thereby helping your arthritis pain to get better too. So if you found this video helpful, please make sure that you hit the like button so this video can reach more people. And if you found this video helpful, then please share this video with your friends so that others can get benefited from it too. Okay? If you have any questions or comments, please post in the comment box below and I'll see you in my next video. Until then, goodbye.